Share. Welcome to the Human Narrative. This is your host, Dorinda. It is a pleasure to be back, to be able to focus on another topic, and just be able to share information with my viewers on different topics. And today I want to be able to focus on anxiety. What is anxiety? It is a natural response to stress that a lot of times all of us may experience, right? If it's a little feelings in our guts, if it's a little feelings in our on our chest, if it's a little feelings sometimes we feel on our body, it is that we may perceive as threats, and sometimes we have to be able to just calm ourselves down in order to understand what's really going on with our body to be able to support ourselves. And it can be persistent, it can be excessive. It all depends on what's going on, and it can interfere with our day-to-day lives, right? So, what are some of the symptoms that one may experience if you are having anxiety or anxious, feeling anxious? This is just excessive worrying, just a restlessness of, or just feeling on the edge, and a rapid heartbeats, right? Or shortness of breath, trouble sleeping or difficulty concentrating, hyperventilation, sweating, and all of those things, your arms, and you're not, just feeling tense overall in your body. Those are symptoms and things that shows that you may be anxious about maybe whatever situations that you are currently experiencing, or maybe experiencing as a result of whatever that may be causing that anxiousness in one's life. So what are ways to manage anxiety? One can, of course, do deep breathing, just being able to deep breathe, inhaling and exhaling, but being able to monitor those steps in ways that you can control your breathing and create some form of balance so that you're able to calm yourself in that space. So it helps you to calm your nervous system. You can also exercise that can reduces the stress in your hormones and boost your mood into feeling energetic and more positive to make more clear and rational decision, instead of just feeling clouded cognitively, emotionally, or just being all over the space, because of course we're human and that's what a lot of times our body experiences, right? um, Other ways we can manage it too is what we eat. What we eat affects overall our internal nervous system as well, right? Our internal being. So what we eat, our diet, avoid excessive caffeine or sugar. Things are going to be causing you to feel fidgeting and all of those things like that. And limit any screen time or social media is to kind of reduce overstimulation or things that can kind of discourage you or causes you to compare, the thief of joy, right? So yes, so you have to be able to make sure that you don't compare yourself. And if that's what is a trigger or concern, you make sure that you don't expose yourself in those spaces that may cause you to feel that way. Therapy and support, of course, can also help. You can go to support groups and those type of things, journaling, and just being able to practice day to day gratitude, being able to think, look at the things that are positive that are happening in your life and focusing on those things. How does anxiety affect daily routines and one's lives, or our daily life? It affects our work and productivity. If you're going to school or things where maybe your performance is being measured, one may have difficulty concentrating on making decisions. There also may be concerns for procrastination, if that is not a concern in the past, where maybe you're a type of person who are punctual, get things done, you know And then you start seeing yourself lagging behind on things that you know normally not, be late on. So you tend to wonder what's going on. Those can be a concern as well, maybe due to failure, fear of failure, increased mistakes or difficulties in completing tasks, avoidance of work or school, responsibilities and those type of things. Relationship and social lives, or life may even be impacted as well. Avoiding social events or gatherings, just wanting to be isolated and just by yourself. Difficulty in expressing your thoughts or your emotions, how you truly feel about situations and things that really impacts you or affects you. Overanalyzing, overthinking, interactions that can cause you to start doubting your own thoughts and your own perception, or even your own needs and things that you want, especially in relationships or in settings in which your voice sometimes may be questioned, or where maybe you don't have the confidence to be able to project, how you truly feel or what your needs are. So all of those things can be questioned as a result of one feeling anxious and all of those things, fear of being rejected, right? If I don't, if I stand up for myself, I may be rejected, I may be judged, so therefore I'm not. So those type of things, relationship and social settings can also, our social life can also be impacted. What are some of the physical health and well-being when it comes to anxiety that impacted one's life? There's trouble sleeping, there's fatigue and muscle tension. A lot of the symptoms, are kind of similar with a lot of other mental health diagnoses. So ensuring that you connect yourself with the right practitioner to be able to assess and determine what is going on and how to best support you based on those diagnoses, right? And weakened immune system. Some of the day-to-day activities or daily activities of self-care that may be impacted is maybe skipping meals or even overeating due to stress, right? Someone person may undereat or overeat as a result of stress. Neglecting your personal hygiene, not taking shower, not brushing your teeth, not combing your hair, not wearing clean clothes, sometimes I wear clean drawers, you know, and I'm not laughing, I'm not saying that in a negative way or when I laugh in a negative way, but that can be as that, just being able to not being able to get up to have the energy to, if you're putting on a clean drawers or something that is important to you, to not see that as important on that day or that week or that month or that year or whatever that depressive symptoms may last. It's a sign that something is going on beyond yourself, and you do need to seek maybe support outside of yourself so that you can get back to that space where you can enjoy yourself. All right. Feeling overwhelmed by small tasks, difficulty maintaining, just structure routines that maybe weren't used to be difficult or was not difficult to maintain. How do you know you have anxiety? So I mentioned earlier some of the symptoms: the persistent worrying, the restlessness, feeling on edge, unable to relax constantly, overthinking. Physical symptoms, fast heartbeat, hyperventilation, sweating, dizziness, nausea, muscle tension, sleep issues, trouble falling asleep or waking up frequently, just racing thoughts, difficulty focusing, just avoiding behavior in general, and irritability, right? Um, of course, those are all of the things that one may experience. I mean, if you're experiencing those things, reaching out to the appropriate provider, whether it's a psychiatrist, and a lot of times, sometimes people tend to reach out to a therapist, and it's okay. Reaching out to a therapist is still a safe space if you and that provider are able to build a rapport that is safe, and you feel like this is someone that can refer you to the appropriate um, provider that could provide the evaluation for the further necessary assessment or evaluation that you may need to continue that wraparound services, maybe not around that particular agency but going forward, right? So that's important. What are the coping skills for anxiety? Of course, some of these things, like I mentioned, are similar. Some of the things that I mentioned with depression on the last episode are kind of similar to anxiety, and maybe similar to a lot of other things that one may be diagnosed with experiencing. Because these are all ways that you can support yourself. It doesn't mean that if one coping strategy works once, that means it's going to work every time. It's not. So it's okay to alternate and figure out what works best in whatever situation one may be experiencing in that moment of crisis. So cognitive strategies may include, challenging your negative thoughts. This can also be reframing your negative thoughts into something positive. Healthy lifestyles may include, exercise, and I've mentioned, being able to have a balanced diet and a good enough sleep. Stress, being involved in stress relieve activities like journaling, engaging in your hobbies, things that you want to do. If you love reading, going for a walk on the park, just being able to play some video games, right? Some people enjoy those type of things. So whatever will allow your mind to relax, right? But you're able to come back from it and function and go forward. So those are things that are important. Social and emotional support, talking to someone, your social support system is pertinent, right? If you have someone that can listen to you, that is a safe space. If you are maybe not able to make decision, you can put someone as a guardianship to be able to make those decisions for you. And even if you aren't able to make decisions, someone that can still be there just as a support system to talk to, a trusted friend, a family member, or a therapist that will help, or mental health provider that will help in those moments of difficulties or crisis that sometimes arises, right? Setting boundaries as well, saying no to things that can be overwhelming, because anxiety sometimes shows up in a way where we show up for other people. They can be very anxious filled, and it's not what you want to do, but you feel like you're obligated to do it because maybe that's someone you care about, or it's the relationship, whatever the case may be. So just being able to say, set healthy boundaries for you and also for those relationships, because you don't want to be in a relationship where you always have to adapt and adjust and all of those things just so that that person is happy and you're not, right? Because it's a two-way street. So setting healthy boundaries and saying no to things that overwhelm you, that causes that anxious feeling, or space for you, where you don't feel like you can express yourself truthfully or show up authentically. And also joining support groups. There are support groups out there that helps, and seeking professional if needed. What are some of the triggers of anxiety? Sometimes you get that funny feeling on your stomach, you don't know why, and it lasts for a while and you don't know why. A lot of times it can be triggered, of course, by different things, in one's life. But some of the things may be stressful life events, right? Major changes in, like, moving or job changes or relationship issues, such as loss. If you lose someone, due to someone passing, or something important, just financial difficulties or job related stress, health problems, all of those things can cause one to feel anxious. Worker related pressure, deadlines that are coming up. I know I feel my stomach sometimes when I have a lot of to dos on my list. So I have to create my list, because I have to pull it out of here and put it on my list so I can function, right? So just being able to create your list so that you're not overwhelmed and you can show up authentically in the spaces that you need to show up. Performance anxiety, such as fear of failure, and such expectations sometimes that our jobs put on us, and not sometimes not even of our jobs, even our roles, different roles and expectations that we have. Social pressure and competition, comparing one another, challenging, that can be challenging at times, social situations or relationships, fear of being judged by people who don't know you, those type of things, or who may know you or who you think know you, maybe in the past, but don't know the new version of you, or who may know the new version of you, or whatever the case is. One may feel that sense of being judged or criticized, right? A lot of times that may also impact anxiousness as well, in one conflict or tension in relationship, right? Loneliness, or even just having a negative feedback, someone sharing how they feel about a certain aspect of maybe what you've done or what a person have done, and that may create, um, one or cause one to feel anxious. Personal factors such as chronic illness, sometimes things that are beyond our control, mental health conditions, PTSD, just depression, anxiety, um, hormonal changes, right? Doing menopause, a lot of different things that our body experiences as a result. Even environmental changes, crowded places. There are individuals who may feel overwhelmed because of the noise. They may cause them to feel overstimulated, as a result, right? It's not because they are weird or because something is wrong with them. It's just because maybe that may be a trauma response, because of whatever situation that person may have experienced. Or it may be just be because of the diagnosis related to whatever history, that may have caused that person to have had to be diagnosed with anxiety. Avoidance behavior may also, be a factor, a perfectionism, negative thoughts and patterns. We talked about substance use, genetic and family, history, news and social media may impact that. A lot of times, when we're comparing ourselves to what other people look like, what they think, how they look, how they feel. We want to look, think, feel, and show up in those ways as well, not knowing that, at the same time, your authentic self is the most purest of all. Not that, being able to admire someone else is not beautiful, it's beautiful. But what makes us, so unique and beautiful is being able to bring our differences in this world that we live in so we can enjoy those differences as humans. Um, all right. So, what are the medications for anxiety? As mentioned in my prior podcast episode on depression, the medication for anxiety can be prescribed to help manage different symptoms. And of course, that may interfere with one's daily life. And these medications can help with supportive services like therapy, lifestyle changes, and different type of optimal treatments, modalities, of course. So antidepressant, the medications that provide the benzodiazepines, medications that, provides the type of immediate, relief from anxiety, as a result of maybe some of the risk or symptoms that one may experience, right? I don't want to talk about medication because I want to keep that more in the psychiatric part, because that's their area of specialties and so forth. But there are medications and type of support out there that can help one who are experiencing or who have been diagnosed with anxiety. And your provider can kind of direct to support you in those directions or spaces that you want to go. But I always encourage patients, have a voice. No matter how much you love and respect your provider, have a voice. It matters, right? we're humans. We do make mistakes, right? As a result of being humans. So, but always be considerate of the side effects of those medications as well. You know, it's human developed and created, so there's side effects. It's not perfection. So a lot of times people who are diagnosed with a mental illness and start taking medications, a lot of times there's this perception of things being perfect. It's not. It's a trial and error, right? And sometimes you find medications that work best for you, and you continue to utilize those, meds and supportive systems. And sometimes it's a multiple steps that one may have to take to get to that point. And I just encourage you, it's not always easy. I just encourage you to keep pushing through because you deserve it, because you deserve it. If you have providers and people around you that are advocating for you, great. If you don't, you have to be your own advocate sometimes until you find that additional advocates. Don't give up. So what are the community resources for anxiety? Of course, you have the mental health hotlines, the National Suicide Prevention Lifeline, the 988, the crisis text line. You also have the Samaritan, the 116, that's the UK line, in Ireland, of course, and also one in Australia. There's support everywhere. Reach out. You're not alone. I know sometimes the world, the system, and even sometimes supportive systems may feel like you know it's not available. Nothing is there. Don't give up, even if that's one thought that's telling you that it's not worth it. It is. Just take a second to reframe that negative thought into something well deserving, and it's going to be worth it, because you deserve it, right? So there are also local therapists and counseling services in your area. Put in your zip code in the area that you live in to kind of figure out what type of uh, government services or local services, that community services that are available to you for free. You don't always have to have insurance or benefits, to be able to receive the services that you need. Of course, yes, there are wait lists, there are lines, but there are services out there. Um, there are also support groups and all of those things, nonprofit organizations and advocacy agencies, the Anxiety and Depression Association of America, Mental Health America, the National Institute of Mental Health, the National Institute of Mental Health. I still wanted to say institute. So all of those different things are out there and are available. There's also telehealth. I know we're busy. You're trying to juggle work, trying to juggle family, you're trying to juggle everything. You're trying to even sometimes wonder if you even exist, right? Trying to juggle everything. So even if it's just connecting with a virtual therapist or a virtual psychiatrist or virtual nurse practitioner, just a mental health or whomever, is going to be important, so that you prioritize your well-being, because you are significant. And if you are not around, can't nobody do what you do. Okay, so prioritize you so you can prioritize others in your lives, in your life, right? So your local clinics and hospitals, your emergency, your employee assistance programs, EAPs. I know a lot of times people will say, "Well, I want to talk at a job. Yeah, I don't want nobody to know my business." That business is supposed to be confidential, okay? So when you go and see your EAPs therapist, that should be confidential. If it's not confidential, that's a problem. That's another situation. But those things are confidential. And you can always use your benefits outside of work. just connect with a therapist outside if you don't feel like you want to use your employer's therapist. Of course, if your employers can provide such benefits to you, because not every agencies or companies are able to do that because based on the sizes and the fundings, right? So just assess based on what's going on with your situation. So faith-based spiritual support organizations are also out there as well. Local libraries and community centers, wellness and meditation programs are available, yoga classes, excuse me. So no burp. So if you enjoy doing yoga, if you enjoy doing different type of meditation, guided relaxation workshops, those are all of those things that can help. Breathing exercises. How do you locate? Google. You can Google it based on your zip code. You can reach out to your local hospitals, to your local mental health authorities. You can reach out to your local mental health, clinics, or even friends just talking. Driving to your local emergency rooms or centers. They can provide all of those informations to you. How to access these resources, just call. You can also, I know in different areas there are resources that you can call 211. So I think that understanding that you're not alone is pertinent, and understanding that that sometimes you yourself may not understand how you're feeling, so you may not know how to explain it to someone else, and that's okay, because I have seen individual in places where they're trying to explain it to someone else and they're frustrated because those individuals don't understand, or those individuals are blaming them because they can't explain it. Sometimes we don't know what our body is feeling, you know, and you shouldn't have to be hard on yourself because someone doesn't understand. Try to support yourself in that space so that you can have the clarity to be able to provide that explanation if needed to someone else, right? So, um, having anxiety is never easy. Feeling anxious about things or threats that have not even happened, or maybe you've experienced something that may be similar, maybe kind of related, and there's this anxious or fearness that it may happen again. Those are all normal emotions and feelings that may occur. But just understand that you're not alone. Just understand that there are tools that you can use to manage those anxiousness, to support you, whether it's just deep breathing and meditation, whether it's exercising, and it doesn't have to be extreme, whether it's healthy diet or just changing your sleep routine, limiting sometimes screen time or social media, contact, going to therapy and support groups, journaling, gratitude, practicing daily gratitude. All of those things can help with our mood and our focus level. So don't give up on yourself. Don't give up on yourself. Even if you do connect with professionals who you feel like are not attentive, it is okay as a patient to say, you know what, this space is not for me. Let me find someone else that will listen to me, and being able to utilize that space effectively. But don't give up on yourself, because you are your best advocate. And if you give up on yourself, then a lot of times it's really difficult uh, to be able to connect with that provider that will hear your voice. Because if you give up, then your voice get dimmed and no one gets to hear what really goes on, which what your needs are. And your needs are important, right? So speak. If that's a challenge, seek the safe space where it allows you to speak, or speak on your behalf. But I just want to thank you all for tuning in again, on this topic of anxiety. I know it's significant and it impacts our overall daily routine, but if this is something that you are diagnosed with or experiencing, please reach out for support. Support is out there. You're not alone. And um, if you feel like you're being judged or in a space where people don't understand, it's because they probably don't, or maybe because they just chooses not to, and it's not your fault. Don't blame yourself for it. Seek the support that you need because you deserve it. Well, thank you for tuning in, and if you need more information on this, reach out, send your question in, and I'll be open to sending more resources and support in your area on this topic. Overall, thank you, and thank you for tuning in. The Human Narratives.